In 2017, shortly after giving birth to her daughter Olympia via emergency C-section, Serena Williams found herself fighting for her life not on a tennis court, but in a hospital bed. What began as a routine delivery spiraled into a medical crisis. A pulmonary embolism, complications from blood clots, multiple surgeries, and weeks of recovery. Despite being in peak physical condition, her postpartum experience revealed a terrifying truth. Even someone with wealth, fame, and access to top doctors could nearly die due to systemic gaps in maternal health care, especially for Black women. What made her survival remarkable wasn't just her strength, it was her voice. After recovering, Serena didn't stay silent. She used her platform to speak openly about her ordeal in Vogue, CNN, and congressional briefings, highlighting the alarming rates of maternal mortality among Black women in the U.S., 3 to 4 times higher than white women, according to CDC data. She emphasized how her own instincts were initially dismissed by medical staff. Despite knowing her body better than anyone, her advocacy sparked change and saved lives. One such life was Linda Carter, a 29-year-old nurse from Atlanta who gave birth in 2019. Like Serena, Linda experienced severe shortness of breath and leg swelling after delivery. When she told her doctors she feared a clot, they downplayed her concerns, attributing symptoms to stress and fatigue. But Linda had read Serena's story. She insisted on an CT scan. It revealed a deep vein thrombosis and early signs of a pulmonary embolism, conditions identical to Serena's. Doctors acted immediately. With prompt treatment, she survived without lasting damage. After recovery, Linda wrote a letter to Serena, shared through a nonprofit partner of the Serena Williams Fund. She credited Serena's public testimony with giving her the courage to advocate for herself, a decision that likely saved her life. Serena read the letter personally. She didn't respond publicly, but she arranged for Linda to join a new initiative, Mothers Who Speak, a digital platform created in partnership with maternal health organizations to amplify the voices of women who had survived near-fatal childbirth experiences. The project included video testimonials, educational resources, and training for healthcare providers on implicit bias and patient listening. More than awareness, Serena pushed for action. She funded research grants, supported legislation like the Omnibus Act, and invested in telehealth programs for rural and low-income mothers. She also collaborated with hospitals to implement Serena protocols, checklists inspired by aviation safety procedures, to prevent postpartum complications and ensure patient concerns are taken seriously. For Linda, the tennis legend wasn't just an athlete, she was a lifeline. And for thousands of women across America, Serena Williams became more than a champion on the court. She became a guardian of it. Because sometimes saving a life doesn't require a miracle, just someone powerful enough to say, "Listen to women. Their lives depend on it." And Serena Williams, the woman who broke records with every serve, had delivered her most important message yet, one that continues to echo in hospitals, homes, and hearts across the nation.